Hey everyone, welcome to Golden Health Method, and my name's Dr. Sean Golden. Today we're going to be talking about using ashwagandha to improve your thyroid hormone levels. So if you've been suffering from hypothyroidism or Hashimoto's disease, ashwagandha is one of those supplements that can really benefit you. It can give you more energy, make you feel like it's easier to get out of bed in the morning, maybe not as sad or depressed if it's due to your thyroid function. So it can really just improve your quality of life. Now, most patients, when their TSH levels start climbing up, which is thyroid stimulating hormone, that's when they're put on Synthroid, which is synthetic T4. That's the traditional route if you're to go to your primary care physician and you are complaining of hypothyroid symptoms and they're going to test your thyroid. Usually they only test TSH. Now, if you want to get a complete panel done, that includes TSH, T4, T3, maybe free T3, reverse T3, and then the thyroid antibodies for Hashimoto's. So why does all this matter with ashwagandha? Because a lot of the times, if your TSH is high, that doesn't necessarily mean that your T4 is low. It could be your T3 that's low, which is the active thyroid hormone. And it doesn't really make sense if your T4 is normal, but your T3 is low, to give you more T4, more synthetic T4 in the form of Synthroid to improve your symptoms. Now, you wouldn't really know that unless you got a complete panel done. One of the benefits to using ashwagandha for thyroid is that it's not like giving extra T4, it's really improving the whole picture. So to give you a background, there's been a bunch of animal studies that have been done over the past decade or so that have shown that ashwagandha definitely increases thyroid hormone, and this is in normal rats or in hypothyroid rats. In pretty much every case, ashwagandha is able to increase thyroid hormone levels. So this is definitely going to be beneficial for hypothyroid. It would not be beneficial for hyperthyroid, so keep that in mind. If you suffer from hyperthyroidism or Graves' disease, it would be contraindicated in that case. But if you have hypothyroidism, it could definitely benefit you. And what they did was in 2018, there was a clinical study that was done where they took people who they called had subclinical hypothyroidism. And really what this meant in that study is that the TSH ranged from 4.5 all the way to 10. And really, if you go into most doctors' offices nowadays, if you're anywhere within that range, you're going to be diagnosed with hypothyroidism. So it's definitely not as bad as someone who has full-blown Hashimoto's, maybe has a TSH of 100. But if you have a TSH of like 6, 7, 8, 9, 10, you're definitely going to feel it. And what they found was after a few months of taking ashwagandha every day, not only did their TSH go down, but their T4 increased and their T3 increased, and they overall just felt better. So it improved the entire spectrum of the thyroid hormone levels. And ashwagandha isn't the only herb that can do this, but it's definitely one of the more powerful ones and one of the more well-researched ones, in which it has a long history of animal studies and now a really good clinical trial under its belt to show that it definitely is effective. Now, one thing I want you to keep in mind is if you are already on Synthroid or Armour or Natroid or any type of pharmacological exogenous thyroid supplementation where you're taking thyroid hormone, be careful when you introduce ashwagandha into your diet, because it can kind of kickstart your body to start creating its own thyroid hormone. And if your body starts creating its own thyroid hormone more like normal, and then you're taking this extra exogenous thyroid hormone on top of it, it could be too much. You can get extra stimulated, you can have hyperthyroid symptoms. So talk with your doctor, make sure you get it approved, and introduce the dose slowly. It's not a supplement you want to start with like 3 times a dose and just see how it goes, because it definitely can increase your thyroid hormones a little too much. It does kind of work over time, so don't expect immediate results within the first few days, but over the course of a couple months, you'll definitely start having some increased thyroid hormone levels. And get some blood work, maybe 2-3 months after you start dosing to see where you're at so that they could titrate your medication accordingly. All right, guys, let me know if you have any questions at all in the comments below about using ashwagandha for hypothyroidism or Hashimoto's. Remember to talk to your primary care physician before you introduce any new supplements into your program. And make sure you like and subscribe the channel. You can check out my Instagram, which is also Golden Health Method, if you find this information valuable and interesting. Otherwise, have a great day, guys, and stay healthy.